everybody. Welcome to Sleep Week. We are here with one of our very special Amen Clinic doctors, Shane Creado.
Hello,
Dr.
everyone.
Creado is a psychiatrist, but he's also an expert in sleep medicine. He did a sleep medicine fellowship at the University of Wisconsin, and he is passionate about getting you to sleep.
Which I'm passionate about too. So, in our last podcast you did with us was so great, and it just did so well. So
That's
we're
wonderful.
excited to have you back.
And we have a new course
We do.
that Dr. Creado has created. It's a 21-lesson course. Sleep is one of the most important things you do.
And it's one of the hardest things for some people. I know I certainly struggled with it after my thyroid issues. And after stressful things like a divorce. I mean, people just really struggle with this. We hear from people all the time about this issue.
Yeah.
So, yeah.
And it was stressful last night.
Dear Lord. So sometimes it's not even your issues. Sometimes it's your spouse.
So I've not
very
been
true.
feeling well. I've had sort of a sore throat and a little bit of a cough. And apparently, what she
Sound like a
says,
freight
because
train.
I didn't know,
Freight train.
is she's just beating me up.
I wasn't beating him up. I'm trying to get him to roll over and move his head. And all of a sudden he's like, stop abusing me. I'm not
So I
abusing
went
you.
and slept with a cat.
So neither
but
one of
this
us got
is-
much sleep last night.
But this is not uncommon. I actually was talking to a patient last night, and one of the big issues in their marriage is
sleep.
his snoring.
Yes. No, I know a lot of couples who start sleeping separately because of snoring. Now, I wear earplugs because you often snore lightly. But there are times, so after you travel, I already know the pattern.
We're doing a therapy session here.
No, I'm actually bringing this up
I'm
because of other
observing in
people.
silence.
Yeah, because other people bring this up to us.
Yeah.
So after he travels, because I notice his circadian rhythm is a little off,
Right.
and he's more tired. After he travels, he tends to snore very loudly, and
Makes
it's
sense.
harder to sort of roll him over.
Yep.
Normally, I can roll him over and he stops. It's like he'll different positions will change that. So, but after you travel, or when you're sick, or when you've got something very stressful and you're not sleeping like you normally do, that's when I notice it. So, and
So it was
likewise,
actually it was stress last week. I had some stress, which then made my immune system more vulnerable because I hardly ever get sick. So stress, immune system vulnerability, snoring, wife abusing you,
More stress.
more stress.
And then if you add that on to, if you're having, like the spouse, if you're having any kind of stressful situation in your life where you're not sleeping quite as soundly, now you've got this combination, right? Am I wrong here?
Oh, you're absolutely right.
Because you're the expert on this. I just am experiencing it. So.
That's exactly what we go for, right? It's always the person's experience that we go with. We start there. What's your subjective experience? I'm not going to tell a patient this is exactly what you need to do. It's what their goals are. And that's how
Right.
we connect with somebody and help them along their journey.
Excellent. So
why do we sleep?
Sleep is one of the most important things we need for survival. In fact, there's something called fatal familial hypersomnia and insomnias as well. If you don't get enough sleep, you will die. So people say you need food, clothing, shelter. I say you need food, clothing, shelter, sleep.
isn't that why they do torture, like sleep deprivation as a form of torture?
Absolutely. If
Now,
you're
why
sleep
is that the
deprived-
first thing you think of?
Because I have a warrior mentality.
In, in fact, if you are sleep deprived, no sensory stimulation as well, your brain will start making things up. You will hallucinate. You can go crazy.
You know, I was the chief psychiatrist at Fort Irwin, which is in the middle of the Mojave Desert where we fought the soldiers, the tank divisions, to fight the Russians in the desert. And their war games would go on for days. And I would often see people get psychotic.
Right.
And come to me because they hadn't slept for 2 days.
Yes.
Now, the treatment for that is not an antipsychotic. It's sleep.
Yeah.
Yes.
We had ICU psychosis. So when I worked in a trauma unit,
Yeah.
ICU psychosis was when, because all of the noise and the beeping and the helicopters coming in and the patients didn't sleep.
Yes.
And so they literally would start hallucinating. They'd start screaming, trying to rip stuff out of their arms. We had to give them medication to go to sleep.
Exactly
So-
right. Same thing with Jerusalem syndrome, where people travel to the Holy Land. They get off the airplane and they're psychotic. With one night of sleep deprivation, you can go psychotic. And you're right, no antipsychotic medication there. They're sent on the next plane back home, and they're fine.
Weird.
Oh, how interesting. So, why do we sleep?
It's needed for most of your functioning, for your immunity, for proper blood flow, for restoration, for memory consolidation. If you've noticed even one night of sleep deprivation, you'll be more irritable, more cranky, especially if your spouse has disturbed
Yes.
you.
Now, there was some research a couple of years ago that showed when we sleep, the brain washes itself. That it actually, we didn't even think the brain had a lymphatic system. So they call it the glymphatic system. And I watched these beautiful movies of this system actually doesn't open up to any significant degree until we go to sleep. And when we sleep, the brain then washes itself. And so if you're not sleeping, trash builds up, especially beta amyloid, that it causes the plaques we think are partly responsible for Alzheimer's disease. And so isn't it interesting? Reagan, who didn't get a lot of sleep, ended up with Alzheimer's disease. Margaret Thatcher, who only slept 4 hours a night, ended up with Alzheimer's disease. Winston Churchill, who only slept 4 hours a night. I'm concerned about our current president, who only sleeps 4 hours a night. And judgment goes down when
For sure.
sleep goes down as well.
Well, and
It
there's,
really does,
There's
yeah.
there's lots of studies on that.
There are many studies.
Even losing 1 hour of sleep
Even
causes
losing
it.
1 hour of sleep. In
Yeah.
fact, they've looked at people who drive after being sleep deprived. They drive as if they would if they were drunk.
It's almost worse, right?
Yeah.
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 We used to
Same
get
with
in the trauma
athletes.
unit. We used to get almost as many people who got into near fatal accidents because of sleep deprivation.
Yes.
I think that kills as many people
Yeah.
as alcohol.
It kills 6,400 accidents every year in the U.S., fatal accidents
Wow.
because of drowsy driving.
Wow.
If you think about it, when you're nodding off, that takes 3 to 5 seconds. If you're driving at 65 miles per hour,
Right.
you're traveling 95 feet per second. So by the time you nod, you've driven around 300 feet. Asleep.
That's how my sister got into the accident with me. She got into an accident driving 75 miles an hour and rolled the car 2.5 times. And I was I was a ICU nurse, and I worked at night for a while. And it's when I hated it because I had to like eat all night to try and stay awake.
Yeah.
And so because I'm not a night person.
Shift work
At
is going
all.
to increase the risk of sudden death and heart attacks as well.
Oh, it's
So
terrible.
I'm glad you're not doing that.
And the way I
anymore.
was eating was just terrible. To try,
Yeah.
I'm like I was so afraid I was going to kill someone, so I was eating whatever I could to just stay awake and not make a mistake. But then I would get off work, and it was when I nodded off at the wheel that I quit. I quit like right away. I'm
Good.
like, this can't work. I'll find something else.
It's interesting you mentioned that because when you are sleep deprived, you will be hungrier. The hormone leptin that regulates your appetite can't work well enough. In fact, for every 4 hours of sleep deprivation you have, your body thinks you need 900 more calories.
Oh,
So you'll be eating more, you'll be gaining more weight. It'll cause you further sleep disruption, especially if you have sleep apnea.
well, maybe that's why nurses tend to gain a lot of weight.
Maybe.
Interesting.
Right, because you go, we're a healthcare organization. Why are we not healthy
But your
ourselves?
priority
and some of it
becomes-
can be the mechanism.
Right. Some of it becomes
Exactly.
caring for, like, you have to pay attention to what's going on with those patients. You can't afford
But
to
we're
lose
not
focus,
caring for the
right?
caregivers.
We're not caring for the caregivers. You know what they say on airplanes, right? Put a mask on yourself before helping the person next to you. But if you're always vigilant on guard, you want to do the best job you can as a healthcare
We can't afford to lose
practitioner, you can't. There are lives at stake over
Right.
there. But at the same time, you're actually training your brain to be hyper vigilant around the time you're supposed to be sleeping. Same thing I've seen in our vet population, the people who are coming back from the wars. They're in danger mode all the time, and
Yeah.
it's going to destroy your sleep.
So, what impairs sleep? What are the things that cause people to have problems sleeping?
Well, broadly, we can think about those as predisposing factors, genetically, or the way your circadian rhythm, your internal biological clock works. There's precipitating factors, say a bad breakup, severe stress, or a certain medication that can disrupt and destroy your sleep. Not many people are aware of this, right? Almost every medication can have an impact on your sleep. Does it cause more dream sleep, less dream sleep, more deeper sleep, less deeper sleep? How does that cause your brain to function even in the next day? And then, of course, the perpetuating factors. Those are the learned behaviors. What are we doing in our part as well to perpetuate the insomnia? It could be things we think are good, like maybe if you can't fall back asleep, lying in bed, tossing and turning. That's one of the worst things you could do, because then you're associating the brain with wakefulness in the bed. So
Makes sense.
broadly, those are the predisposing factors, what makes you initially at risk, what triggers the sleep problems, and then what perpetuates them. And then
So we should probably have a couple of cocktails before bed to. A
as-
lot of people do that, right?
Well, 'cause they have a hard
some
time
of the
shutting their
things
brain off.
that a lot of
Yeah.
people do.
Yeah.
So they go to Ambien quickly.
Oh, terrible drug.
Which is insidious because once you start it, it's really hard to stop it.
really hard to
Right.
stop it.
They use alcohol as a way to sort of settle themselves down, but 3 hours later, when the alcohol's wearing off, it wakes them up. Plus, it's a diuretic, so they're going to have to go to the bathroom. Plus, it's hurting their brain, so they're more likely to continue to have sleep problems.
Yes.
So, what else do they do?
I don't like alcohol because
They're on their phone.
yeah, a lot of screen time. They're watching TV. They're reading in bed.
They're watching Fox or CNN, and
Yeah.
they're throwing stuff at the television because they're so angry.
Oh yeah, no, I stopped watching the news. I can't. I just cannot. I'll get the headlines. I'm done because it's just too disruptive. But reading actually makes me sleepy. So if it makes you sleepy, it's okay. Correct?
Not necessarily. So the way I go about thinking about this with my patients is, if they don't have a sleep problem, they wouldn't really come to me unless they want to maintain their gains and do what they're doing right and know what they're doing right and know what they're doing wrong. If you're sleeping well and you like reading at night in bed, that's okay. It's not ideal, but it's okay. But if you have a sleep problem, reading in bed is associated with keeping you up as well. So you need to break that cycle. Get a little comfortable cubby, create your own space separate from the bed. Could be nice comfort,
I
a little
see.
couch.
So maybe near your bed, but not in your bed.
Exactly.
Okay.
Because you need to break that cycle.
I always say read boring stuff that you think you should read,
Right.
but is boring. So biochemistry used to put me to sleep. Like it was
Right.
2 pages and I was done. Or if you read the book of Leviticus
Right.
in the Old Testament, you'll like be out, after the 17th, he begot
Right.
that person. When we come back, we are going to talk about some of the other significant causes of sleep disruption. And then we're going to spend the last 2 podcasts in this week talking about how do you get a better night's sleep. Stay with us. Use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or on our supplements at brainmdhealth.com. Thank you for listening to the Brain Warriors Way podcast. Go to iTunes and leave a review, and you'll automatically be entered into a drawing to get a free signed copy of the Brain Warriors Way and the Brain Warriors Way cookbook we give away every month.